Hi, my name is Dr. Thompson.
And my name is Dr. Wilson. You'll be using this iPad to help you make an important medical decision about two treatment options for your child's appendicitis.
This iPad will give you information about your child's appendicitis, describe two treatment options, help you become actively involved in the decision-making process, and help you make the best decision for you and your child.
On the next screen, you'll pick a guide who will walk you through this iPad experience. We hope this information helps you, and more importantly, gives you confidence that the treatment option you choose is the best one for you and your child.
Pick a guide to walk you through this experience.
Hi, I'm Pat. Thanks for choosing me. Let's go over a few instructions on how to use this iPad. Tap the screen at any time to bring up the controls. At the bottom of the screen, you can pause the video, rewind the video, and adjust the volume. Closed captioning is also available by tapping here. One more thing. At the end of each section, you can choose to replay or continue on to the next section. Let's get started. Please press the replay or continue button now.
Before you make a decision about your child's health, it's important that you understand what appendicitis is and what's happening in your child's body. The appendix is a long, thin pouch that hangs down from the large intestine. It has no real function in the body, and sometimes it gets blocked and infected, making it swollen and painful. Appendicitis is just a fancy name for swelling in the appendix. Understanding what is happening to your child is important. It's the first step to becoming involved in the decision-making process. When you're part of the team making decisions about your child's health care and the options available, you feel more confident about those decisions.
When we were at the hospital, we were overwhelmed by what was happening to our child. There was a lot of information hitting us at once. We made sure we understood the facts about appendicitis so we could better understand our treatment options.
Okay, now that you know what appendicitis is, let's talk about your treatment options.
Because we caught your child's appendicitis early, you have two treatment options: surgery or treatment with antibiotics alone. The first option is surgery to treat your child's appendicitis. It's called an appendectomy. Here's what it means for you. Your child will be given antibiotics in their IV. Before starting surgery, they'll be given general anesthesia to put them to sleep. Surgery is usually performed by making 3 small cuts on the belly. The picture shows the most common locations of these incisions. Ports, a camera, and 2 instruments are placed through these incisions in order to do the surgery. The appendix is then removed with a device that cuts the appendix off of the large intestine and repairs it at the same time. The appendix is then placed in a plastic bag and removed from the body. Then the incisions are closed. The entire procedure takes about 1 hour. Usually with surgery, patients stay in the hospital 1 to 2 days. Recovery at home takes about 5 days before your child returns to school. Typically, it takes about 2 weeks before your child will return to all activities, including sports. The second option to treat your child's appendicitis is with antibiotics only, and here's what it means for you. Your child will receive antibiotics through an IV here at the hospital for at least 1 day. Doctors and nurses will check on your child frequently to ensure that your child is getting better. Usually, with antibiotics alone, patients stay in the hospital 1 to 2 days. When your child feels better and is able to eat, he or she will continue taking the antibiotics by mouth for about 7 days at home. Children can typically return to all activities, including school and sports, in 2 to 3 days.
Now that you know the facts about appendicitis and understand your treatment options, let's talk about the risks and benefits of each.
Either of these treatment options is reasonable, and there is no absolute right or wrong choice. However, there is likely one choice that is best for you and your child. In order to help you make this decision, let's look at the risks and benefits of each treatment option. First, let's talk about the risks. Studies show that with surgery, about 1 out of 10 patients experience a complication. The most common complications are minor and include infections or problems with the wounds. Less common, but more serious complications include infections inside the belly, bleeding during surgery, injury to other organs near the appendix, and the need for additional surgery due to scar tissue in the belly. Studies show that with antibiotic treatment alone, about 1 out of 10 patients will not get better and will need an appendectomy while in the hospital. Another 1 out of 10 patients will have their appendicitis come back and need an appendectomy at a later date. This means that altogether, about 2 out of 10 patients treated with antibiotics alone will eventually need an appendectomy. Also, the side effects of antibiotics may include some diarrhea, nausea, or vomiting. Now, let's talk about the benefits. With surgery, about 9 out of 10 children will not have a complication after an appendectomy. In addition, your child will never have appendicitis again. With antibiotics, about 8 out of 10 children will not need an appendectomy. In addition, your child will have less pain and a quicker recovery. We want to help you make the decision that is best for you and your child. This involves knowing the facts, understanding the treatment options, and weighing the risks and benefits of each.
The next step in making the best decision for you is figuring out what's important to you. Every family that walks through our doors has different priorities and concerns. It's important that your treatment decision today is in line with what's important to you. We have an exercise to help you sort out the pros and cons of surgery and antibiotics as they apply to your personal situation. In this exercise, you're going to decide how important the features of each of the 2 treatments are to you. Touch and drag the statement on the left over to the number of stars on the right based on how important you think it is. The stars are ordered from most important, 5 stars, to not at all important, 1 star. And don't worry, if you change your mind, you'll have a chance to change your answers at the end of this exercise. Now it's your turn. I like the idea of my child avoiding the risks of bleeding and infection, my child not having to take antibiotics at home, my child missing less school and returning to activities more quickly, my child avoiding general anesthesia, my child not getting appendicitis again, needing to take less time off work to care for my child, my child potentially not needing an appendectomy, my child avoiding side effects from antibiotics. Here's a summary of your ratings. Use these when talking to your doctor. The statements to the right are the ones you decided were more important to you. The statements to the left are the ones you decided were less important to you. The statements highlighted in purple are reasons you might choose antibiotic treatment only. The statements highlighted in orange are reasons you might choose surgery. To change an answer, slide the statement box to move it to a new column. When you're finished, hit Print Summary. You can use the summary to help you decide which treatment option is the best for you.
Research shows that being actively involved in your child's treatment decisions improves the outcome of their care. You know the facts about appendicitis. You understand the treatment options as well as the risks and benefits of each. and you've figured out what's important to you. Now, the final step is to ask questions about information you don't understand or talk about additional concerns you may have. Communication is key.
No healthcare decision is easy. It's important to ask your questions. Having the right information about my child's condition, looking at the pros and cons of different treatment options, and being encouraged to work with the doctors and nurses made me feel like I had a say in what happened next.
I was scared when I came to the hospital for my appendicitis, but I began to feel better when the doctor answered my questions.
What's critical is that you feel confident about the decision you make. This means that in addition to asking questions, you need to voice your concerns to the doctors and nurses.
I was struggling with the decision because I had concerns about both options. I talked with the doctors and nurses about those concerns, and that discussion helped me feel confident that I made the right decision for my child and family.
At this point, you may be ready to make a decision. However, it's okay to be uncertain. We want to help you arrive at a decision so you feel comfortable, confident, and informed. If you'd like to hear more from doctors and families about common questions and concerns and how they work through their uncertainty, please press Hear More. If you're ready to speak with a doctor about your decision now, please press Ready.
People are different, and they have their own reasons why they don't feel ready to make a decision. It's often based on concerns they have about surgery and/or antibiotics. If that's the case, it's important to talk to the doctor about your specific concerns.
What's critical is that you feel confident about the decision you make. This means that you need to talk to your doctor about what's concerning you and what you don't understand. With surgery, concerns of parents and children often have to do with the risk of surgery or the recovery time. With antibiotic treatment, a common concern is the risk that the appendicitis might come back. In addition, some parents are concerned about getting their child to take antibiotics at home.
Once you identify exactly what's concerning you, you should be upfront and talk to the doctor who can give you more information. Doctors and nurses want to hear your concerns. They can be more helpful when they know what's going on with you. Let's hear from some families who are uncertain about their decisions and how they resolved their concerns.
I thought an appendectomy was the right option for my child, but I had some concerns about general anesthesia. I figured out that I just needed a little more information about what the surgery involved. And once I discussed that openly with my doctor, then I felt comfortable and ready to make the decision.
Even though I liked the antibiotic-only option for my child, I was concerned about the appendicitis coming back. My doctor gave me more specific information and statistics about patients who chose treatment with antibiotics. Having that information, I felt confident and positive about my decision.
I was worried about how long I'd be in the hospital. And when I told the doctor, he talked to me more about my two choices. I felt better after I talked to him.
Sometimes parents and children feel uncertain about the decision because they still have questions. Please don't hesitate to ask your questions. Getting your questions answered can give you a sense of control about the decision you're about to make.
When thinking about an appendectomy for my child, I had some questions. How long will the surgery take? How long will my child be out of school? How will you do the surgery? The doctor's answers helped me understand how the surgery would work. We ended up feeling we made the best decision for our family.
The choice to receive antibiotic treatment instead of surgery was new to me. Asking questions was important so I could feel comfortable and confident about this decision. I asked, what happens if my child doesn't get better with antibiotics in the hospital? What's the likelihood the appendicitis will come back after we leave the hospital? The doctor's answers gave me the information I needed. It helped us feel we made the best decision for our family.
When would I be able to eat? When would I be able to go home from the hospital? When could I start playing soccer? It really helped to get answers to these questions.
When you talk openly and honestly with doctors and nurses, it helps us do a better job of taking care of your child. So when you talk with us about your decision, let us know what questions and concerns you have.
In addition, when we talk with you, we might not explain things fully or talk in a way that you understand. If that happens, we would like you to speak up and let us know. Good communication is the key to making the best decision for you and your child.
You've now completed this experience. If you're ready to speak with the doctor about your decision, please press Ready. If you would like to review any part of this experience again, please press Review Videos.